Hello, viewers. Good afternoon. Today, I am with a very important topic of human concern. We all know that since 2020, the whole humanity, the whole mankind is suffering because of the reason uh, that there has been a pandemic onslaught all over the globe, and lot of human sufferings are there. We know that it started from China, Wuhan of China. Then it spread all over the globe, and people suffered a lot. And India was not exception to it. So we have seen the first wave. We are passing through the second wave. Now, a news was published in Reuters news agency on 18th of June this month that India may brace the third wave of COVID-19. And in this respect, I would like to uh, know you that a SNAP survey was conducted by the said news agency, in which about 40 experts from around the world were participated. Before I take up further on this, I would take you to have a glimpse of today's update on COVID-19 and vaccination situation in India. In this respect, I will take you to the concerned website. I will share this screen. So this is the news today's which reports about the latest update here in India. This is PIB Press Information Bureau news release and is published in uh, the OpenView, which you may visit on our website, the openview.in. It shows us the latest position. As earlier also I reported that there is consistent decline in cases of COVID-19 in India. Uh, the last in last 24 hours, the cases which have been reported today are to the extent of 53,000. So there is decline in cases. Graph shows this. This is the graph. I will once again I will show you this graph. It has not been displayed on your screen. Yes. It is yet not displayed. Yes, it is displayed now. So you can see this graph, 53,000 cases in last 24 hours. So COVID-19, the second wave is almost now declining, and the cases are coming down and down every day. You see the position of this shows the position of situation of India, more than 28 crores. So, and I would inform you that today, from 21st, as the Prime Minister of India, Shri Narendra Modi, have announced uh, previously, no free shots. Now the population is being inoculated, and free vaccination is being provided to all the adults. So it has started today. Now I would take you to the website which has published the SNAP survey. Wait for a while because we have to switch. Now this is the news. India should brace for third COVID-19 wave by October, says health expert. This news was published. You can see Bangalore, June 18. A third wave of coronavirus infections is likely to hit India by October. And although it will be better controlled than the latest outbreak, the pandemic will remain public health threat for at least another year, according to a Reuters poll of medical experts. So here the news was published, and we have taken up this discussion analysis on this news that whether there can be a third wave of COVID-19 or not. That is the point which we'll focus upon today. Now, first I will lay down before you what is said by in this SNAP survey. This SNAP survey was conducted from June 3 to 17, and on 18th it was published in the newspaper by news agency Reuters. This SNAP survey, in this SNAP survey, experts from various fields were participated, like doctors, scientists, virologists, epidemiologists, professors. All such people uh, participated in this SNAP survey, and they were 40 people who participated in this SNAP survey. Now, out of 24 of 40, 24 participants, about 85%, predicted next wave by October. Out of 40 participants, 24 said that there may be a third wave of COVID 19 by October. Out of these, three said in September. The three dissented on this point and said that it will be in September. Then 70% of the experts who participated in this SNAP survey, they were of the opinion that though there may be possibly a third wave of COVID-19, but now it will be better controlled. They were of the opinion कि हो सकता है कि थर्ड वेव हो, लेकिन इस बार वो पहले वाली हालत नहीं होगी, ये अच्छी तरह से कंट्रोल्ड होगी, ये उनका कहना था। तो उन्होंने किस आधार पे, ऑन ऑन व्हाट प्रीमाइसेस दे ओपिन that it would be better controlled if there would have been a third wave. तो उन्होंने जो फर्स्ट जो चीज़ बताई, उन्होंने पॉइंट जो बताया, उन्होंने कहा कि नो वैक्सीनेशन इज रोल्ड आउट नाउ, population is being vaccinated speedily. Therefore, naturally, it will control. It is a protective cover against the pandemic. तो इसका जो असर है वो अच्छा होगा, because there is inoculation on massive scale. More than 28 crores, 29 crores have been inoculated today. Means that the vaccination is, government is taking care of it. Vaccination is on the speed. Swiftly they are doing it now, so that more population be inoculated, uh, then more quickly you will achieve the herd immunity. Now, they also refer to the previous COVID, the current wave, the second wave. They said during this wave we have experienced a lot of devastation. Of we were having infrastructure problem. There was shortages of oxygen, shortages of bed, shortages of hospitals. They refer to that. But because of this experience, now the government is on the line to increase the public health infrastructure at a faster pace than it was in the previous two waves. We have now hospitals like DRDO, COVID hospitals are being created by the government of India speedily in every state, even in our state, in our UT, the Jammu and Kashmir, we have the DRDO COVID hospitals here. One in here in Jammu at Bhagwati Nagar, and the other is there in Kashmir. And likewise, in other states, we have created. Now, government is on the line. Government is creating now because they want to save the population from the onslaught of this pandemic. तो गवर्नमेंट जो है अब पूरा ध्यान दे रही है इसके ऊपर और ज़्यादा से ज़्यादा वो हॉस्पिटल्स बेड्स ऑक्सीजन ऑक्सीजन नाउ they are producing a lot of oxygen now. Hopefully, there will be no any laxity, scarcity of oxygen. So all these things that the which we have experienced during the current second wave, now it it has no it will be no benefited in the sense that what we were not having in the current wave we will have in the second third wave if it happens by god's grace. I'm sure it will not happen, but if it happens, then the government is very much prepared to cope up with this situation. तो ये जो है 70% एक्सपर्ट्स जो है उन्होंने बोला ये और एक हमारे जो डायरेक्टर हैं एम्स के डॉक्टर गुलेरिया ही सेड another reason for better controlled pandemic third wave is he referred to one to vaccination and other to natural immunity which the population has achieved during the second wave. So these reasons they quoted for that how the third wave will be better controlled. Now, other point which I want to focus is that the possibility, likelihood of this third wave of coronavirus, the COVID-19, perhaps one reason the experts are quoting, जो कोट कर रहे हैं एक्सपर्ट कि क्यों हो सकती है उसमें one of the reasons they quoted was less vaccination of population. Eligible population they quoted India is having 950 million eligible people, and out of it 5% of the population is vaccinated. But I'm sure that it is now increasing. It will be increased now. Uh, because of less inoculation, vaccination, the possibility, the probability is there. The population which is not inoculated, they may give space to the virus because because of the reason that gatherings, rallies, close parties, not using the masks. This is the reason that if you avoid all such things, it gives space to the virus to spread and to mutate. That is the problem. That is the issue. If it spread, then it mutates. It multiplies, and it leaves out the variants. We have to protect the. We have to prevent this. So this was one of the reason, and this is my own opinion, because experts means by this that if uh, there will be less population inoculated, vaccinated, the living population which is not vaccinated, it becomes vulnerable to infections because of the reasons which I have stated, uh, people may avoid masks, people may avoid uh, may not avoid rallies. They may go and enter into the rallies. They may not avoid even parties, close parties, gatherings. So when it happens, because it is the human nature to meet, to gather, then space is likely to be given to the virus. So this is one reason. Now another issue which was raised in this SNAP survey was which is the population which is likely to be most affected. Out of 40 experts, 26 said that children under 18 may be more at risk. This was the opinion of 26 experts out of 40 experts. The reason which they quoted is worth consider that since there is no vaccination for the children so far, so they are not under a protective cover of the vaccination. This was the reason that experts said that the children under 18 may be at risk. Then further, some of the experts they have shown their concern that if the children are infected, if uh, infection is transmitted, if they contract the infection, children, then there may be structural problem because uh, this this is the area of pediatric. We may be having less doctors who deals with the children diseases. There may be shortages of pediatric ICUs beds. So this concern have been shown by the experts in this SNAP survey. But I'm sure it will not happen. The government of India is taking all care, and they will do focus on this point, uh, this crucial issue that if there would be a third wave and if the children under 18 are affected, then they will be having sufficient uh, infrastructure for to deal with such problem with the children. Hopefully, the government of India will focus on uh, on this issue. Then, out of these 14, 16 sat and 14 dissented. So 14 dissented. 14 said, no, children under 18 might not be at more risk. So there is dissent going on in this SNAP survey. Uh, this also you take into consideration that dissent is also there. There may be and there may not be possibilities. This indicates the possibility of maybe and may not be. Then very important, to which I advert you that 11 experts said that this pandemic threat, it will remain for a year, and 15 said 2 years, 13 said over 2 years, and out of these these experts, two said that it will never go away, which I have what I have understood, and you will also try to understand this, that when the expert says that risk will never go away, it means that perhaps the underlying principle of saying this, that risk will never go away, maybe might be that pandemic will be converted into endemic. He may be referring to the endemic part of the pandemic. It will never go means it, sporadic. Somewhere you may find sometimes that is on specific places. That is that is in endemic form. This is what I have understood from this version of the two descent of two experts, that it will never go away. This is what I have understood. You also try to understood what it means. I think this is the only meaning which we can give to this. That though it will not go, but it will become endemic in specific areas, specific where you may find some cases in endemic form. So this was the SNAP survey, but at the end, one expert from the University of Maryland said very encouraging thing, that he said that COVID-19 is a solvable problem with a vaccination, and he referred to India, that he said that India will achieve herd immunity by vaccination and exposure to disease, exposure to infection within a year. Not within a year, I'm sorry, in 2 years. He said in 2 years that India will achieve, India will develop herd immunity by way of vaccination and exposure to infection. This is what the expert Robert Gallo, director of the Institute of Human Virology at the University of Maryland and international scientific advisor, he said. So this is encouraging point, that in 2 years time, that India will achieve herd immunity by way of vaccination and exposure of the disease. Now the point is, which I want to analyze here, is this. This was all about the SNAP survey of Reuters. You have seen that it is not 100%, but it is dissenting. Some are agreed and some are not agreed, because uh, now the things are on the advanced side. Technology has intervened in this. Researches, then vaccination, upcoming of the introduction of vaccinations for COVID-19, then emerging of more and more public health infrastructure, uh, then many some medicines also. So the things are on the decline. Infection is on the decline. Infection will take place there only where we become negligent about it. We don't care about it. Their election, it adds to this infection. What is now in since 2020 we are facing this issue, this pandemic issue, and we have seen a lot of human sufferings, not in India only, but all over the globe. The situation sometimes it was so worse. Then it started improving. Now it is improved to substantially it is improved now. We are now on the whole side. We know that we can control it. We have vaccinations now. I would like to suggest, it is my analysis, my opinion, that if people take care and know, since there are tools now in your hands, tools like vaccination, hospitals, oxygen, everything you have now. But population, people have to exercise because virus is still there. Virus is not fully gone. Therefore, utmost care is required to be exercised by the people. And what is that care? From today, take you start doing this. If you have not started, you start doing it, so that we could avoid third wave. You know how the second wave happened. You just uh, be reminiscent of the second wave, how it happened. If you able to analyze this, how it happened, then you have to, what you did in the second wave, you have to avoid this in the third wave if it happens. It will not happen, but if it happens. Now, how it could be avoided despite having the tools? This also you know that despite vaccination, you have to wear masks. You have to take that care. It is protective cover for you, but despite this, you have to take care. You have to wear masks. You can't say that we will take off this after vaccination. No, don't commit this mistake. So comparatively, no. What what we could not do in the second wave, we should do in the third wave if it happens. So first thing you have to take into consideration is that don't ever give space to the virus, because if you give space to the virus, then it will spread like anything. It will spread like a fire because its transmission is very, very fast. and it is exponential transmission. It how it is such because we know the that how this infection is contracted. By now, everyone has come to know this that it is the droplets which transmits from one human being to another human being, and that transmission is that transmission happens from certain distance. That distance is a space. That space we have to avoid. How you can avoid this? You can avoid this only if you exercise one of the recommended norms, principle of social distancing. That is very important. No, just don't uh, take it like this. Social distancing means that you have to uh, go very far or this or that. No, there are certain factors where you have to exercise this social distancing. Say, for example, you have to avoid gatherings. If you gather, what will happen? You will contract this infection by giving space to the virus. So, avoid, even if you are allured by the rallies of anyone, avoid it. Whether it is political rally, whether it is any rally called by any celebrity or any film actor, because virus has nothing to do with all these things. Virus is very sagacious. He said the virus is very clever. He knows human beings will give it this space. Here here you have to use your this common sense, your prudence. That virus is asking for space. We have not to give, because if you take care of yourself, right, it means you will take care of others also. Others may be your friends, others may be your relatives, others may be your family. Therefore, I am preparing you for what the SNAPS survey have said, that there may be. It is still in maybe. It is not. It is not. It is not firm that it will happen. But if it happens, then what is being stated here, you have to take into consideration that you can't use dereliction in this, because then you will be at loss. When you will be at loss, your society will be at loss, everybody will be at loss, because this is the infection which spreads here and there. So, first important principle which you just embed in your mind, paste in your mind, in your heart, that you don't have to give space to the virus. Therefore, exercise social distancing. Now, since this virus is spread by droplets. Therefore, it is important here that you use cover your face with masks. That will be helpful for you, for everyone on this globe. That wear masks. Then the importance of wearing mask is that suppose if you are talking to someone and you suddenly sneeze. When you sneeze, then you leave the droplets. Your mouth shoots out the droplets in a very fast manner. Those droplets, if you are wearing a mask, then that mask will act as a barrier to move those droplets further, travel further to somebody who is to whom you are talking. The impact will be less. So using mask is another very important principle for you. We have seen that how the people are uh, so negligent that they gather, they goes in rallies, and you have seen that no masks, nothing, no social distancing. You understand what I am trying to convey? This is my message. I am trying to convey you the message of not providing space to the virus, and you it will happen only when you have substantial massive rallies, gatherings, close parties. So avoid all these, prevent to prevent this infection. Then after mass, the third very important principle is of frequently washing your hands, because you go out, you go here, you go there, even if you have worn mask, you touch surfaces, virus may stick to your hands, and when it sticks to your hand, this is the common practice, natural practice among human beings all over the world. That sometimes you are touching this area, sometimes you are touching this eye, this and that infection, when that virus when comes closer to your eyes, close to your eyes, it may enter into through your eye, it may enter into your mouth. So washing of hand frequently is recommended. So these are the three principles: wearing masks, social distancing, and washing hands. For washing hands, don't look for a very quality, costly, or if you have a soap, you can wash your hands with soaps. All cannot afford sanitizers and all that. Therefore, use your soaps, wash it like this, these areas up to these portions, like this, like this. Uh, uh, Once or twice you do this, and your hands will be all washed. Uh, Also, when you wear a mask, frequently wash it. When you sleep, go to bed, you wash your all your masks which you have used during the daytime. And then another day you use the fresh masks, washed, clean masks. So continue this practice. So this is my message. This is message from our news portal, the openview.in, that what is stated here, you do follow this. I am sure that since this survey is dissented, there is dissent in this survey, and if we exercise the due diligence, the principles to avoid this infection, I am 101% sure that there will be no such wave. And our government, and if it happens, we are well prepared. Our government is well prepared, provided you also exercise uh, the most important, don't give space to the virus. Stay home, stay safe. Only during the necessity you go out, and when you go out, you use all these principles: wearing masks, distancing, washing hands. With this, I will end this episode and say goodbye. Take care and follow uh, what we have focused on in this episode. Thank you very much. Goodbye.